Everybody. It's a real pleasure to welcome you to this Immersive webinar. My name is Professor James Field. I'm the Association for Dental Education in Europe, Graduating European Dentist Task Force Chair. It's a real pleasure to be with you on this webinar. I've got some of my colleagues, which I'll just introduce to you, and they'll introduce themselves again later on. But we've got Chloe Barrett, who's the founder and CEO of Immersive. Hi, Chloe. We've got Kyle Kelly and to join us, Steve from UCLA as well, and you'll be hearing from them shortly. So the webinar is structured around ADEE's themes of reflect, recognize, and reimagine. And Chloe's going to start by sharing some highlights from the latest Immersive survey. Nearly 350 US-based students focusing on what students are demanding from today's dental education, which will be really interesting. For me, it was interesting to hear about the fact that students want more investment in technology enhanced learning, which is a common thread certainly nowadays, but also using supplemental resources they can use on their own. So hopefully there'll be some really interesting insights from this talk. We'll then move on to the recognize section, which is where Chloe's going to pose the question about whether these needs are seen as priorities by partner schools. And that's where she'll hand over to the UCLA team to talk a little bit about their own experience and their examples of using Immersive within their cohorts of students as well. And hopefully you can then start to see the tangible benefits of offering that service to students. And then finally, as we reimagine, Chloe's going to return to how Immersive addresses the needs of students that they identified in the survey and how it can help to positively shape the future of dental education. So again, I hope you enjoy. And without further ado, I'll hand over to Chloe to begin the presentations.
Thank you, James. And thank you for everyone joining today. Really excited to share more around, as mentioned, this survey, pass it over to the UCLA team, and then reflect on how Immersive is supporting higher education as well in healthcare. So just some information regarding this particular survey. So we did a large student survey with dental students across 26 states in the US, and we discovered a lot of insightful information and useful information for educators, for students themselves, and also for us in education who are really trying to support with technology solutions. So I would say, I think thinking about the insights and looking at based on like the survey we conducted, and there was so much overwhelming positive results for learning technology, which is fantastic to see. And there's a clear opportunity to increase institutional use of technology as well. So some of the critical insights and really looking at the broader student satisfaction metrics. In the first instance, on the surface, it seems there was a high student satisfaction. However, when we dug into more of the survey and the questions, there was a lot of uncertainty and confusion around how their satisfaction stemmed from potentially wanting to be confident, but equally not. And so there was quite a lot of information brought through these different questions as well. So most of our respondents actually indicated, as mentioned, that they were happy with their dental education experience. But clearly, as we dug deeper into this, there was definitely areas which could be better supported. And so I am really excited to share more in terms of the areas where they really want the support, and yeah, the feedback we got. So just moving on to the next slide, where we dig more into the feedback we had on interactive learning technologies and which type of interactive learning do students really want to have more within their classroom, outside their classroom, and to engage with more. So as we peel back the data further, you can see that our respondents had quite specific ideas about the kind of technologies and capabilities that they want to see as part of their dental education. So that told us and tells us, should I say, that learning technology means different things to different students. So it's really spanning across lots of different formats and modes of learning. So this is a really important point to reflect upon because it highlights a real kind of discernment amongst dental students. They don't necessarily want learning technology for its own sake, but because they have quite a clear vision on what it does and how it does help them. They have different forms of modalities and different areas of technology that they really want to engage upon and with. I think also just to mention, in regards to, as we know, the students studying today have instant information everywhere, from social media to, the TikTok generation of quick videos. So actually, from an education point of view, and us as educators, it's really difficult to keep that attention span. And, I think students also they understand this and they also are telling us we want this in a type of, I suppose, education in a different type of mode to be able to learn as effectively as we can. So that's just something we picked up upon within the survey as well. So if we just move on to the next slide, so thinking about preference or priority. So going into even further into our findings, we're left with some context as to why students want interactive learning technologies in various forms we saw in the last slide. So clinical skills practice was named one of the three of our respondents, and this was via actually an open response from a question where they could actually just name any factor at all that they would like to see more of. So this is really important actually to know. So going back to our initial set of data where 91% of respondents agreed or strongly agreed that learning technology helps them retain and apply knowledge, we're seeing a much clearer real picture here painted by students who are looking for technology in a way that actually applies their knowledge but also strengthens their clinical skills, and they can then retain key information across a variety of different modes and formats. I would say obviously this kind of reflection we can only get so far. I think students saying what they want very clearly, but the question then becomes, are these technologies actually able to improve learning outcomes? And this is a really important question that us at Immersify are always trying to dig into in regard to learning outcomes, improvement in learning, improvement in confidence, and actually how does, Immersify itself, but equally other technologies in the field, how are they supporting learning outcomes, confidence, and really supporting our dental professionals of today or what students will become. So just to pause there in terms of and focus on that learning outcomes piece, I am delighted to hand it over. So as we move on to the next slide of recognition, I would like to hand it over to Dr. Kelly Visnam, Dr. Steve Lee, and Kyle Tupacs. I know Kyle is going to be doing the presentation, and Kelly and Steve will be on hand to answer any questions as well. So they're going to present a really informative study that they conducted, which explores the question of whether digital learning platforms can bridge gaps in clinical performance and potentially help to recognize the effectiveness of these technologies. So yeah, really looking forward and to handing it over to them to present further. Thank you.
Okay, thank you, Chloe. I'm just going to get our presentation up. And can everybody see it?
Yes.
All right, so yeah, before we get started, I just want to give a shout out to Rose Malky. You'll see here on the bottom. She's our our student research assistant who did the majority of the work on this research project for the Immersify application. So she couldn't make it today because she's currently in class as a D2 student here at UCLA. And then it's also myself, Kyle Tupaz. I am the fund manager for the UCLA CBCE program. I'm also joined by Dr. Steve Lee, who's our director of our international dental program, and Dr. Kelly Vitsum, who is the director of the community-based clinical education program. So the title of our research project is Impacts of a Mobile Learning Application on Dental Student Clinical Performance. And just a brief disclaimer before we get started, both myself and the UCLA CBCE program have no actual or potential conflict of interest in relation to this program or presentation, so we just want to put that out there. And brief overview, we're going to talk about the UCLA CBCE model to kind of give the audience a context of what we're trying to do with the CBCE program here at UCLA as far as outreach. We'll talk about the project inception with Immersify, and then we'll go on to the project specifics. And then finally, we'll talk about the results and the next steps. So the first thing we want to talk about is dental health professional shortage areas. You'll see here the parts in the darker just have more population as far as dental health professional shortage areas. So what we want to try to do at the CBCE program, we try to increase access to care and use our students as a workforce to help address the health shortage or the health professional shortage. So the community-based clinical education program at UCLA, our goal is to enhance students' education while increasing access to care through sustainable community service. Our students do 2 4-week rotations during their final year of dental school. They're involved in direct patient care at our external affiliate sites. A lot of these sites are safety net sites, such as federally qualified health centers, where underserved or patients with no insurance get access to dental care. And we give students real-world experiences with different practice models. One second. And then let me just move on to the next slide. Yeah, so let me talk about I'm going to talk about the impact of the CBCE program so far at UCLA. It leads to increased cultural competency because the students are exposed to different demographics, increased clinical experiences and confidence because the students have more, they do more procedures while they're out at our external sites. They're exposed to different delivery models that serve underserved populations, and it also increases the likelihood that our graduates will choose careers in public health. So you'll see here in the graphic on the right that after the CBCE program was fully implemented in 2019, about 1 in 5 of our graduates go on to work in public health. And then finally, that's a recruitment tool for our sites to hire students after they graduate. So CBC by the numbers, we are a data-driven program. So since this program's inception in spring 2018, CBC has rotated over 700 pre-doctoral DDS students and over 50 residents at our CBCE sites. They've delivered care to over 41,000 underserved patients. Our students have completed nearly 100,000 dental procedures, including just under 12,000 oral surgeries, 30,000 restorative procedures, 4,400 crown deliveries, and just under 1,700 root canals. We've exposed students to different delivery models. That includes private practice, community clinics, dental support organizations, mobile dentistry, free clinics, and then also different patient populations, including pediatric patients, geriatric patients, military veterans, and homeless. So now getting to the timeline of the UCLA and Immersify affiliation of how we implemented Immersify into our program to help our students. So in July 2022, after about 3 years, UCLA CBCE students showed a history of very low scores on a prescribing oral medication assessment item. This is where the preceptors that supervise them at the external sites, they rate the students on certain skills after they're done with their rotation. And we just noticed that they scored very low historically on prescribing oral medications. So in October 2022, we met with the Immersify team for a demo, and we decided in July of 2023 for the class of 2024 to implement the Immersify application. So our students were using that during that school year. We presented our preliminary findings at the ADEE conference in New Orleans in March of 2024. And then just a couple months ago, we presented a full year's results at the ADEE conference in Dublin, and we'll be doing the same thing during this webinar. So really quick, the study progression, we're going to talk about the analysis of the historical data, just revealing an underperformance in students' knowledge of prescribing oral medications. We'll also talk briefly about a literature review, that previous literature Noted positive outcomes for online game-based learning amongst healthcare professional students. And then we're going to move on to the piloting of the Immersify application, which we started in fall 2023. And then finally, we'll talk about the results, the statistical analysis where we compared the preceptor assessment scores of Immersify versus non-Immersify student cohorts. So the historical data, we collected data from the previous 3 classes from 2021, 2022, and 2023. This is the graph here on the right is our 14-point assessment tool, and we'll focus on the part that's circled. So the 4th year students, even with their self-assessments, which are the green and blue lines, you can see that there's a noticeable value there. And then what we're going to focus on for this study is the red line. That's the preceptor assessment score. So that's how our preceptors rated our students after they did their 3-week rotations. They rated them on that prescribing oral medications question, and we just saw that it was consistently low over the years. So we decided to do a literature review. Previous studies revealed online game-based applications were interactive, engaging, and favorably viewed amongst healthcare students. They were beneficial in improving students' knowledge, clinical skill, and motivation to learn, but there were less studies in dental-specific learning environments. So in fall quarter of 2023, we decided to pilot the Immersify application to our students before they went out to their rotations. So they were required to complete the oral medication and prescribing module. This consisted of 47 lessons and 25 multiple choice quizzes, and this was given to the students 2 weeks before their rotation started. So for the performance, 736 preceptor assessments were collected. There were 84 assessments for the class of 2024, which is the Immersify group that were exposed and were able to use the Immersify application. And then there were 652 assessments for the other 3 classes, which was the non-Immersify group that were not exposed to the Immersify application. And we ran a Mann-Whitney U test for the statistical analysis to compare the Immersify scores versus the non-Immersify group scores on the preceptor post-rotation assessment of the students. And this graph here shows the results. So you can see the trend. The blue bars are the group that had the Immersify application, and the orange bars are the groups that didn't have it. So you'll see the trend in the distribution kind of shifts more to the right toward higher scores, which are the 4s and 5s. And when we ran the test, we saw that there was a significantly higher score reported for the Immersify group versus the non-Immersify group. And for this study, there were some limitations. The students did report some technical difficulties, and also the time spent on the app was not able to be tracked. So we couldn't really see if intervention dose, had an effect on student scores. So that's something we want to probably look at in the future. Also, the application was only recently incorporated into the curriculum, so we had a limited sample size. So this is something we want to do as far as further research goes. So the takeaways, student use of an Immersify application prior to rotations is associated with increased preceptor assessment scores in the knowledge of prescribing oral medications. This suggests a potential benefit for app and game-based learning. This current study demonstrates potential efficacy in dental education settings as opposed to just medical education. And then future research, we want to look at addressing other low-scoring items on our assessment. We want to get a larger sample size. And then in the future, we also want to look into a more similar comparison group to make it more like an experiment. And that pretty much does it for ours. At the end of the session, I'm going to pass it back to Claude, but we will have a Q&A session, and Dr. Vitzum and Dr. Lee will be able to ask any or address any questions at that point. So I'll hand it back to you, Chloe.
Thank you so much, Kyle. Yeah, that was great. And we definitely saw, as you mentioned, really insightful information from your study, and yeah, looking forward to do more with you. I think some feedback from us as well, from Immersify side, we as we were going through our version 4 of the Immersify platform, as you were doing the study as well, we're looking forward to doing this again with the updated version of Immersify as that was a couple of years ago. So, well, a year or two ago. So yeah, really looking forward to that as well as we explore more areas. So thank you all very much, and looking forward to any questions that you have soon as well. So as we move on to, so just thinking about that reimagining piece now. And so thinking about how, educators and for institutions, it's not necessarily enough to know that technology works or that students expect it. But you've also got to think about all those practical aspects that come with technology adoption, what kind of technology you may need, how to implement it, what you can do with it, and so on. What was really also interesting for a takeaway from the UCLA study was that when it was made mandatory, it made a huge difference. Rather than asking the students and saying, here's a supplementary resource that you can go and use, but actually not aligning it with any curriculum outcomes or objectives, it was it had a different effect. So that study was even more, I suppose, really insightful for us at Immersify to really understand the differences between the mandatory approach of, if you do use Immersify and integrate it and embed it into a curriculum or modules, it has significantly increase positive effect. Whereas we've seen previously and done some studies in the past in regards to it just being supplementary, it doesn't have as higher effect. So yeah, it was really interesting to learn about that, and that's how our partners now can, of course, do both, but we found that really insightful from the UCLA study as well. So I think that brings us on to the third theme actually of ADEE 50s, which imagining, and really thinking about how do we reimagine a curriculum and a set of teaching methods with interactive learning technology at its core. So as we move on to the next slide on closing the expectation gap. So we've already seen the kinds of features and capabilities students are looking for, which is a really useful guide to selecting a platform that does use technology that meets those expectations of students and educators of today. And it's really important to remember that even with students point to a wide variety of features that they want to experience and want within their dental education. That doesn't mean that they're asking for 10 different types of solutions. I think it's really focusing on, well, what is going to make a great impact across different areas of the curriculum, and how do these work? So thinking about flexibility, adaptability of platforms, rather than having lots of different types. So rather thinking of, I suppose, a term of like more technology, it's really about choosing solutions that can deliver multiple modes of learning within one singular environment. So if we move on to, that brings us on to the next phase of the curriculum mapping. So when selecting a learning platform, it's absolutely necessary and needed really to think about how does that platform affect our curriculum, our faculty and our students, and how is it really going to help them? So as you can see here within the curriculum mapping document, we know that educators have really busy workloads. Faculty are super busy, loads of things to do. And so at Immersify, we really wanted to make something that was accessible and really fit within every different types of curriculum and program. So the platform wraps around your curriculum, integrates into your program, rather than you trying to adjust to a certain platform and a certain technology. So the process we use is to make sure digital learning is effective and directly fits in what is already being taught, rather than the other way around. So we've really shaped these learning plans to really fit within existing modules. We identify where interactive lessons and simulations can line up with your learning outcomes and provide then direct access to these. And so we can often use QR codes, which align with different modules, different topics, and also time-based, time-stamped. And I think something to mention from a data analytics point of view, although previously, we could only track so much, as we building out our huge advanced data analytics portal. We have now continuing to use the data analytics to really assess the time spent in every single area of Immersify. So really being proactive rather than reactive in that approach, which is constantly updating features on that as well as we're growing all the data set. So just thinking it's a really important step, because thinking about reimagining our curriculum to include more consistent use of learning technologies doesn't mean that we are completely overhauling that curriculum itself, but actually just finding places where extra resources can slot in to provide students with an interactive experience that they ultimately expect. So if we go on to the next slide at reimagination in practice. So once we've got our digital content mapping in your program, we'll find then a huge array of options as to what your reimagined teaching approach entails. And we wanted to end by giving some ideas as to what this can look like. So you might, example, choose to reinforce lesson content by sharing a QR code at the end of your class, giving students a chance to practice further in a simulation activity or even taking a quiz. But we find mostly amongst our partners that actually having access to digital content allows them to tackle teaching models that wouldn't normally have the time to implement themselves manually. So if we take an example like the flipped classroom approach, so thinking of that simple idea of giving students key information before the class, then they go into the class, they perform a simulation or a lesson or an assessment while being in that class setting or that flipped classroom setting or even lecture room setting. You can then, as faculty, discuss and practice these different areas of study, but you can also think about that more targeted support and so on. But thinking around the admin time as well and the cost of creating extra resources, so we take all that off your hands as well. So if we move on to the next slide, where actually you'll see a set of simulations, we just wanted to showcase some of the different types of simulations we have, such as augmented reality. So thinking about, again, from a simulation point of view, and if you were in or outside the classroom setting, you could, the students could ultimately go through these different simulations and be able to, what we call, fail safely. As we would all prefer students to be able to fail in a safe environment rather than being in a clinical environment and ultimately not being able to complete that. So using gamification within these settings, being able to, as you can see here, practice on different types of patients when charting different teeth sets and being able to then use the software within the application and simulation itself. And this can be done millions and millions of times. So that repetition of practice is always there too. The use of personalization. So if I got a question 2 and 4 wrong, Kyle got a question 6 and 8 wrong, we would only have content that is personalized to us, and it wouldn't, it'd be based on how we found that content difficult and then suggest new content. So being able to build in certain areas of proficiencies and being able to map against those proficiencies as well within the platform. So if we move on just to the next slide, and just thinking about our next webinars coming up, I'd love to share more around what we've got coming up in terms of workshops, flipped classroom workshop approach, pre-matriculation lesson planning. So we're going to be holding a set of webinars which are really sort of a deeper dive into how the concepts of flipped classroom and, as mentioned, pre-matriculation programs are working, and how we can support these. And then also more insights around student expectations, around learning of technology. And of course, you can also download our free white paper that provides lots and lots of information on our previous study and survey with over 300 students in the US across 26 states. So we'll be doing more and more surveys, more and more insights, and we're looking forward to sharing more as we do these. So thank you so much for all the speakers. Thank you so much for attending the webinar today. I will just pause and I will just hand it over to everyone that attended today. If you have any questions for myself or the UCLA team, please post them in the chat and we can answer those. Thank you. Okay, we have a question. So thank you very much for that. So I would like to know, do I have any quiz based on simulation? If answering this correctly, we do have quizzes that are based on the simulation. So yeah, if there's certain simulations, there'll be quizzes based on that simulation as well as briefs, debriefs. So yes, we do have we have that as well. OSCE type of simulations as well through all different modules.
I just want to chime in here. Hi, everyone. I'm Kelly. When we were doing our project with Immersify, one of the comments that we received from students afterwards was that those simulations, the simulation-based questions and the case-based questions that they had, where it was a pretend patient, and I know that we don't really have time to demonstrate that here, were actually some of the most popular things that students felt particularly helpful, because it felt like for them, it was, being put in a particular situation, what would be the clinical decision making that needs to happen. So that was something that we received good feedback on.
Thank you, Kelly. That's great.
Hi, Anne. Thanks for asking the question. Our plan is right now, we're kind of in a pause right now, but our hope is that we'd be able to continue to study with additional cohorts down the line, so potentially next year. Good to see you.
Great. I think that might be all the questions.
Mei Wei Pang said I could see she's asking about a demo anywhere.
Ah, okay. I couldn't see that. Yeah, of course. We can absolutely follow up and provide. Okay, yes, now I can see. Thank you. Yeah, absolutely. I can send over, we can send over. Okay, sorry. The team are already on it. They've already posted the link.
Oh.
I answered it too slowly. Yeah, absolutely. There's a link to actually an open YouTube video that shows yeah, lots of things. Thank you. Okay, we have another question. Okay, pre-matriculation was mentioned in one of the slides. Does Immersify have much experience with that approach? Yes, I can answer this just quickly. So yes, we do. We work with a lot of partners on our pre-matriculation. We actually have a a program now that can slot in for pre-matriculation. So really support that area, and ultimately just being able to get feedback and data as throughout that approach is really important as well. So yes, we do have that. And Dr. Pang, as an instructor, could I organise any quiz by the resource, like to recognise quiz based your system? So we have lots of different quiz questions which are randomised dependent on that subject. So there's loads and loads on the back end system which basically get filtered through. So we don't tend to ask any educator sort of to create their own. Of course, it's a potential option, but we don't do that. We just have so many on our back end and keep updating them and keep refreshing them constantly that they're never becoming out of date, or there's always enough as well. I think if that's all the questions, of course, we have everyone's details available. So if you want to reach out to any of the team at UCLA to be able to ask any further questions regarding their really insightful research project, please do so. And anything else from the Immersive team that you'd like to know more, please reach out to us too. But yeah, I just want to say thank you so much to everyone. Thank you so much to the UCLA team as well. Looking forward to doing more and more with you. And yeah, thank you everyone, and have a great rest of your day.
Thank you.
Thank you. Bye.